Welcome back to KETK Texas Live. Well, joining us in the living room now is Mike Eckhard from CHRISTUS Trinity Mother Francis.
And today she's going to talk to us about PatientSafe Phones. Good morning.
Good morning.
Good morning.
So if you could explain real quick, what is a PatientSafe phone?
Well, that's the name of the vendor that we purchased the application from. So we took a normal smartphone and we added the application from PatientSafe. What it does, it allows us to securely communicate with the care team about the patient in a patient context. So when you open the app, you actually get a list of the patients you're caring for. So you can then communicate to another member of the team, and it ties that patient's name so that the doctor isn't wondering, is that the patient in 4 or 6, or is that Mrs. Smith this or Mrs. Smith that?
Yeah.
It's exact, gives him the exact patient that we're referring to. And it's all HIPAA compliant and secure.
So you guys said you started this up in May. Why did you decide to implement this program then?
Well, the nurses had some older technology that it was time to replace, and so we did. Smartphones, everybody's got them now. We wanted to give the nurses a tool belt. Get rid of the tool belt, put everything on one device.
Yeah.
So because we went this way, we're able to give them apps on the phone that gives them access to things like drug medication, drug information. They don't have to then go to a computer and look things up. They're right there at the bedside,
all in
and we
one
have a
spot.
question. Let me quickly open that up and I can talk with you while I'm caring for you and give you the most recent up-to-date evidence-based information.
Yeah.
So in what ways does it, improve the work that healthcare workers are doing?
When you call somebody and they're busy, they can't answer the phone right then. So if you need to communicate something that's not an emergency, you can send a text that they can get to when the time is appropriate for them and then get back to you. So it really helps improve communication all the way around.
And so the nurses will be using this in the rooms with patients. And
Yes,
you're kind of
they will.
explaining you didn't want there to be any miscommunication. They're not texting on their phone. Kind of tell us more about that.
Right. We want people to understand that this is a fully legitimate phone. It's a smartphone,
Yeah.
but it's not their personal device. They're not communicating with their friends or taking pictures to put on Facebook. They're actually providing real care for the patients and communicating it with the rest of the team.
So is this a glimpse into the future of where, communication between healthcare workers is going?
It is. We've started this on a small scale. We started within the heart hospital. We added other units and we'll continue to add units. We've also brought in the first group of physicians. Our hospitalists have the app on their phone, but we'll be able to offer it to additional physicians too to help improve the communication among the entire team. And then we can add it to our other hospital campuses as well.
Okay, sounds good. Thank you so much.
You're welcome. Thank you.
Nice.